Paying for high medical bills is probably the last place that you want to see your money go during the holidays. Medicare is one program that can help substantially reduce out-of-pocket medical costs for the elderly and the disabled. And Southbay Health and Insurance Services has made it their mission to serve as a resource to educate seniors and others about their Medicare plans and the programs. So here to tell us about how you can enroll in Medicare is Southbay Health and Insurance Services President Patricia Salas. Welcome, Patricia. So tell us about Southbay Health and Insurance Services. What is it?
We are an insurance agency that specializes on helping people with Medicare or Medicare and Medi-Cal find the plan that best suits their needs, whether that would be a Medicare supplement, a Medicare HMO, a PPO, or a prescription drug plan.
Okay, and I understand, I imagine some of our viewers have Medicare, but I also understand we are in the middle of an enrollment period and the deadline is quickly approaching, so tell us about that.
We only have 2 weeks left. The annual enrollment period for people with Medicare that want to choose a prescription drug plan or a Medicare HMO plan ends on December the 7th. So we need to be able to help them prior to that. What they should be doing or should have done already is compare the options available to them, compare the costs that accompany those plans, and then choose the plan that they want to be with for all of 2013. Those choices have to be completed and their applications must be submitted by December 7th. Wow. If they don't make the choice by December 7th, then whatever they have this year with whatever changes will apply to that plan for 2013 will be what they have for the remainder of 2013.
Okay, and let's talk about the changes. Why is it important that viewers, anyone looking to get into Medicare, understand what the options are?
It's very important because of cost. Traditionally in Northern California, the plans that were available under the Medicare HMO option were quite expensive. They either had high premiums, high deductibles, high co-payments, for the most part. Since last year, we've seen a number of introductions into the market that are 0 monthly premium, extremely low co-payments, but the only way that you get them is if you compare them during this period, make sure that they make sense to you, make sure that they work with your doctor. So it's key that they educate themselves, compare their plan, and either choose to remain with what they have because it makes the most sense, or change to something that makes more sense to them financially.
And I have to admit, health insurance for myself, and I imagine for others, can be pretty intimidating, you know, understanding what the plan means, and I imagine that's where Southbay Health and Insurance Services comes in, correct?
Correct. What we do, all of our services are free of charge. We don't charge anything for what we do, but we help them navigate through the choice mess that they have in front of them. It has been said in some counties that people with Medicare received upwards of £1 worth of paperwork during the elections.
Wow.
And AEP. So if you can imagine, £1 is about that much that came in the mail, all postcards and single things that came on their own, and they expect you, each one is an invitation to a different presentation, each one is presenting you with a different plan, so if you spread them across, it would be quite a bit of the floor space here that it would take up, so it's confusing.
How do you navigate all that information?
You got it. So what we do is we look at what's important to the member and we say, all right, let's find what makes the most sense to you, because that's all we do. But it's also important to mention that if anyone watching us today has Medicare and Medi-Cal, they tend to be people who receive assistance from the state of California. They're more limited financially. There's a new plan that's available to them for next year, and it also makes a lot of sense that they call. But you know, our message, definitely the very urgent message, is for those who have Medicare and either don't have a plan, wish to compare their benefits, wish to make a change, they have to call the number that's on screen now. It's 1-888-988-8072. And call us. Someone will come to your home, they will assist you at the comfort of your home, and the services are free of charge, so you don't have to pay for anything. In the best of cases, get educated. If it makes sense to move and change your plan, then do so, but we're here to assist.
Yeah, we're here to assist, navigate all that information that you were just talking about. And too, for viewers, not just for our viewers with Medicare, but maybe our viewers that have parents that they know that have Medicare, and they want to help assist their mom, their dad with all that information and make sure they're making the right choices for them individually. Can they contact you too?
For sure. In most cases, if it's a child or a caregiver that's assisting the person with Medicare make their decision, or it's overseeing their health care, we prefer that they're there because they need to understand what the person is getting themselves into, what the benefits are, what the co-payments requirements are. And yeah, by all means, please make the call on their behalf. And if you're the reps run late in the evening, so if you're working, they'll happily see you at 6 or 7 and make sure that you're there while the presentation's being made.
Yes, very important. So then how do people reach you once again so they can get all this information?
Call the number that's on the screen. It's 1-888-988-8072. We've been having, I think we've done over 500 meetings in Sacramento alone. But now we're running very low on meetings because we're spending most of our time with people at their home. We're just getting towards that tail end of the season. So right now, if you want to see an agent, call the number on the screen and have someone come to your home.
And once again, when's the deadline that all this needs to be
December
done by?
the 7th. So if you have Medicare and you don't have a plan, if you have a prescription drug plan that you think you may need to change, if you want to change the existing plan you've got, please give us a call. And if you have Medicare and Medi-Cal, we finally have a product for you. We didn't have one before for most people in Sacramento County in particular. Now we do, and it works with Hales Physicians. So it's one of your premier medical groups in town, and it's again designed to help them out.
Wonderful. Thank you so much, Patricia.
It's our pleasure to be
Very
here.
important information, as she mentioned. The window is closing, so make sure you act now.